So for people with limited bone, or they've been told they don't have enough bone to get dental implants, you say you work with people with limited bone. Tell me about that.
I work with people with limited bone all the time, and they end up leaving with teeth that don't come in and out.
Okay.
And one day the same as somebody that has a lot of bone. The reason we can do this today is because of alternative site implants. We can find the bone and place the implants there. If they lost bone where their teeth used to be, we go into an area, well, basically like the inside of the cheekbone or the zygoma, and we use a longer implant that's angled, or we go behind the sinus and we place it. There's a little island of dense bone in there as well. So we get that stability for them to leave with those teeth that don't come in and out, and they still leave that first day.
So people told you don't have enough bone, it may just because of the experience of the dentist they went to?
Yes.
Is that really what's going on? Possibly?
Absolutely. I've been doing this for 20 years, but I have done extra training. I went to Brazil and I took a course from some of the top surgeons in Brazil and the United States, and we did nothing but alternative site implants on dozens and dozens of patients.
For people with limited bone?
Patients with limited bone, exactly like that.
You travel. I mean, you say you travel all over the U.S. and of course out of the U.S. to learn implant dentistry. Is there really that much to it?
It's always changing. The technology, the way that we make the teeth has changed since I first started doing this. Before it was just done in a lab by a lab technician, and now we utilize the SmileFi technology to help capture that smile that they want. And we can take that all the way through to the 3D imaging and printing and 3D milling, all the way through to their final zirconia teeth.
Now what about pain? You say they're numb and then they're sedated. Is this one of those things that, what can they expect there? I mean, if everything goes well.
Let's face it, a lot of patients don't come to the dentist or avoid going to the dentist because of bad past experiences. It's fear. They're afraid somebody hurt them in the past. Understandable. That can be traumatic. But the way we do these procedures is with IV conscious sedation. And what that means is that we're going to start an IV. And Randy, we give them a relaxing pill. So when they come in, they're not shaking in their boots. They're
already relaxed.
They're relaxed. They're chilled out. They feel like they maybe had a martini or something like that.
Okay.
We get the IV started, and that's it. Most of the time, patients report back after the procedure, they don't remember anything. We're still going to numb them up. We're still going to use the local anesthetic so they're comfortable. They're not feeling anything during the procedure. But that's all done after we start the IV. So they're probably not even going to remember that.